Hello, I'm excited to be talking to you today about a program brought to you by Medstar Health and Mosaic Group called Project Heart, helping expectant people achieve recovery together. During this session, some of the goals are to discuss Medstar Health's support in general of pregnant and postpartum patients who are using alcohol and drugs, the process for universal screening to identify patients with substance use behavior, interventions to discuss behavior change and enhance motivation, and peer recovery coach support for recovery and wellness. The goals of Project Heart are overall to help patients receive support and care that they need and deserve. The goal is to identify people who are early in pregnancy as much as possible to ensure that we're working with them in whatever way they are willing to work with us to decrease or eliminate substance use behaviors. Promoting healthier birth outcomes for the baby, increasing access to substance use treatment and also recovery supports, increasing support for women who are pregnant and postpartum, and also improving maternal child engagement and bonding, promoting healthy child development. There are 4 components of Project Heart that I'll be discussing today. The first being patient identification. So Project Heart is part of a larger program called Reverse the Cycle. And in the emergency department, every patient coming through is screened for risky substance use behavior. Similarly, patient identification occurs at every encounter for OB and GYN patients. Another component is the response from the healthcare team, which we'll go over in detail. Peer support, what is a peer recovery coach? We'll describe that, and linkage to treatment and coordination of care. The first component is patient identification. So why do we screen patients for risky substance use behavior? It is important to acknowledge that the risk associated with substance use is different during pregnancy and postpartum than it is among men or those who are women who are not pregnant or postpartum. So as an example, what may have been considered typical or low risk alcohol use before pregnancy now becomes high risk as soon as pregnancy occurs. And there's no amount of alcohol that's safe for pregnant women. This applies to other substances as well, including some prescription medications. When a person doesn't change their substance use behavior when they're pregnant, there's often a stigma associated. People may think things like, she's a bad mother, or she doesn't really care about her baby. These statements reflect bias and judgment that is known to be harmful to the person that's struggling. Not being able to change their behavior is a reflection of illness, specifically a substance use disorder. There's also a chance that they've not changed their behavior because of misleading information found online or from other professionals that are not educated properly in what aligns with the current research. A substance use disorder, or SUD, can include a number of substances, including alcohol or drugs, that cause significant impairment, health problems, disability, and failure to meet responsibilities. There are long and short-term risks associated with substance use in pregnancy, and substance use often begins before someone knows they're pregnant. Patients are screened and identified at attributed OB/GYN practices as well. As I noted, substance use disorder can not only include alcohol or drugs, but also other illicit substances or prescribed medication. Misuse of these prescribed medications can also fall into this category, and a diagnosis of substance use disorder is not dependent on how much or how often somebody is using, but rather the effect that the substance use has on the patient's life. Throughout our presentation, you'll see references to opiate use disorder and alcohol use disorder. These all fall under that general category of substance use disorder. So patient identification at Medstar Health. All patients 12 and older will be screened at triage every visit. Even if the patient just left and they're coming back into triage, they are to be screened again. Screening questions are to be asked exactly as worded, and screening includes validated screening tools, such as the Audit C and the NIDA drug screen for adults and the CRAFT for adolescent patients. For patients 18 and above, prior to the universal screening, there are some pre-screening questions. One notes, is the patient pregnant or not currently at this time? The second is an expert request. This may be selected by a nurse or any other provider, clinician, if they believe that the patient did not screen positive, but can still benefit from peer recovery coach support. So these may be patients who deny substance use, though it shows elsewhere, such as in a urine screen or through additional conversation that they are using illicit substances or alcohol, or for a patient who did initially screen positive in a prior screen, but is currently screening negative. The Audit C, or the Alcohol Use Disorders Identification Test, looks like this. This is a screen asking about alcohol use, and it calculates a total score. It is really important that you ask the questions exactly as worded in here and not default to a summary of, do you drink, do you smoke, or do you do drugs? It's also especially important to make sure that you're not asking leading questions that may result in inaccurate answers, such as, you don't drink, right? Or you don't do any drugs, do you? So please make sure that you're asking the questions exactly as worded, starting off with, how often did you have a drink containing alcohol in the past year? Additionally, if the patient says never, I haven't touched alcohol in over a year, we want to make sure that we select never, and then we don't need to select the next two questions at all. They can be left blank. It'll generate a score of a 0. The 90 Quick Drug Screen, again, please ensure that we're not defaulting to a summary of the questions, do you drink, do you smoke, do you do drugs, but instead asking the questions exactly as worded. In the last 12 months, did you smoke marijuana, use another street drug, use a prescription painkiller, stimulant, or sedative for non-medical purposes? Though marijuana is legal in Maryland, it is not safe for consumption among pregnant women and could pose additional dangers for postpartum women. So we want to make sure that even if a patient is using some type of medical marijuana, we want to make sure that we're answering yes to this question, please. If yes, then please select which drug or substance the patient is using, the date of last use, and you could note at the bottom that either the patient declined screening or they were unable to be screened for one of the following reasons: cognitive inability, psychologically unstable, nonverbal, or they were unconscious or unresponsive. The CRAFT is a screen created and validated for the adolescent population ages 12 to 17 years old. This is actually validated up to age 21. So you may see in some of your ambulatory settings, the screen being used for patients 18 to 21 as well. Part A will always be asked, and the pre-screening questions will always be asked. You'll note at the top, if the patient is pregnant, yes or no. And then if there is a CRAFT request, similar to the SBIRT request, this would be if the patient screens negative. However, there's reason to believe that either using alcohol or substances, and they may benefit from peer recovery coach support. Part A, those 3 questions are always asked. Did you drink more than a few sips of beer, wine, or liquor, or any drink containing alcohol? Did you use any marijuana? And did you use anything else to get high? You would note how many days within the last 12 months. A rough estimate is okay if there are several, but how many days within the last 12 months does the patient admit to using these substances? Part B, number 1 is always asked. Have you ever ridden in a car driven by someone who was high or had been using alcohol or drugs? If all 4 of those questions are a no, then the CRAFT will discontinue. You don't need to go any further. If any of them is anything other than 0 days, or Part B, question 1 is a yes, you will continue with the remainder of the questions. So what is a positive screen? A positive screen doesn't necessarily mean that the patient has a substance use disorder or we need to try to get them substance use treatment, but instead it's an alert to the provider and the peer recovery coach that an additional conversation should be had to discuss the patient's alcohol or substance use. Scoring a 1 or greater while a patient is pregnant on the Audit C does indicate a positive screen because we know that there's no safe amount of alcohol use during pregnancy. And we want to make sure that the patient's properly educated on the risks associated with alcohol use during pregnancy. Similarly, if the patient answered yes to the drug question, that they've used illicit substances either in the last year, and this could be or may not include drug use during pregnancy, this would be a positive screen. Even if the patient admits to not using substances during pregnancy, we want to make sure that the provider and or the peer recovery coach is intervening with the patient to offer any additional support that they may need, being as though they may have cut down or quit using fairly recently. For the adolescent population, A 1 or greater on the CRAFT screen is considered a positive screen. Please note that the provider will be alerted through the EMR. However, we encourage you to also notify the provider that the patient is screened positive for risky substance use behavior to ensure that brief intervention is delivered. The healthcare professional intervention. So brief interventions are a short conversation to discuss any risks associated with alcohol and substance use and providing education, and also to discuss any changes that the patient may be willing or interested in making. The provider will deliver a brief intervention with the patient, and a peer recovery coach will also meet with the patient. Both the provider and the peer recovery coach document their interactions in the medical record. What is a peer recovery coach? Peer recovery coaches are also employed by the emergency department, also on some psychiatric units, inpatient and outpatient through Medstar, and they are individuals who are in long-term recovery from alcohol and or substance use. They're currently working their own recovery process, so they can speak from personal experience on their struggles with alcohol and substance use and really relate to the patient in a way that other clinicians and staff are not relating to the patient in their role. They're an employee of Medstar Health and a member of the care team, though they are a non-clinical member of the care team. They're a professional and they can be paid or volunteer. At Medstar, they are paid professionals, though they are non-clinical position. They're advocates, guides, mentors, and support for people who are impacted by substance use. Peer recovery coaches, they receive referrals from not only the hospital, but also the attributed ambulatory OBGYN practices. The goal is to help support the patient as early in their pregnancy as possible. However, if that isn't possible, if they had not been identified early, they ideally will be identified on the labor and delivery triage so that the peer recovery coach can begin to support that patient. Even if the patient is established or has a known history of alcohol or substance use, or you know that the peer recovery coach is meeting with the patient already, please conduct the screening and the peer recovery coach will continue to be connected with them. So in summary, every patient is screened using the ESPERT screen or CRAFT 2.1 at every visit. A positive screen is indicated for adults by any alcohol use during pregnancy or any illicit substance use within the last 12 months, even if prior to pregnancy, including marijuana. And for adolescents, a score of a 1 or above on the CRAFT screen. The provider delivers and documents a brief intervention with the positive patient in real time, and the peer recovery coach will follow up with all positive patients either in person if they're currently on shift or by phone for continued support. Thank you so much for your time today. If you have any questions, please see your labor and delivery or mother baby unit director.